we have kind of abnormal levels of asthma in our state relative to the rest of the country, and we haven't really thought about what to do when there's wildfire smoke. How do we stay safe? Not that many people have central air conditioning, so when public health guidance is to stay inside, how effective is that really? I'm Anna Maassel. I'm a PhD candidate at the Rubenstein School of Environment and Natural Resources and a student fellow at the Gund Institute. I study connections between the environment and human health, and specifically I'm looking at the impacts of wildfire smoke on the health of children with asthma in Vermont and the northeastern United States. A lot that's been studied about wildfire smoke so far and health impacts is focused on areas that are really familiar with it, like California or Australia, and it's pretty new to Vermont and this part of the United States, so not much research has been done yet, and a lot of people are really concerned about it. So studying it here at a local level has benefits for our community. It's also a lot easier to do because there's some really strong connections and networks in Vermont of the Department of Health and the Health Network at UVM, of people that are really passionate about understanding this better. So last summer in 2025, if you were in Vermont, you might remember experiencing really poor air quality. The sky was really hazy, it was hard to see the sunset, like the sun kind of disappears really ominously. And I remember for myself, I wonder like, ooh, should I go outside or should I walk my dog? But I'm a pretty healthy person. If I'm a parent with a child that has asthma, I imagine those questions are even more concerning about what do I do? Part of my research dives into answering that question. How are parents responding to wildfire smoke, and do they have the knowledge and resources to do so? The poor air quality that we experienced in 2025 was caused by wildfires in Canada, and that smoke came across the border. So those wildfires were thousands of miles away, and wind and weather carried that all the way to us. And so we're curious if that is really enough to detect an impact. And we're starting with the most vulnerable population that would be impacted by that, and that's children with asthma. Asthma is the most common chronic childhood disease, and Vermont has one of the highest rates of asthma in the country. Children with poorly controlled asthma can experience a number of symptoms, from coughing to more serious exacerbations that can send them to the hospital. Another part of my research asks if children facing social and economic disadvantages, maybe with less access to health care, are more impacted by wildfire smoke. In Vermont, our respiratory health is under threat from a number of other things, like wood stoves are really prevalent in Vermont. Our housing stock and building stock is quite old. So other than wildfire smoke, there's kind of other things that could be impacting children's respiratory health and contributing to higher rates of asthma here. Wildfire smoke complicates summers, a time when children can be outside, away from a lot of those indoor asthma triggers. Providers now have to work with patients to create summer emergency action plans, something that they haven't had to do before. We know that our health is linked to our environment. We know that green space is linked with mental health. We know that wetlands mitigate flooding. We know that forest cover is associated with children's digestive health in developing countries. There's a lot to study here, and they're really, really important connections for understanding our relationship with our world. The negative health impacts of climate change are indisputable, even in areas that used to be considered climate havens, like Vermont. That's another reason why this work is especially important now. I care about helping people answer the question, why should I care? Why should I care about conservation? Why should I care about how we use our lands? And people are motivated by different things. Some people are motivated by species extinction rates. Some people are motivated by dollar values, like how much money am I saving from protecting this building from flooding? I think something that we can all agree on is the importance of health. We can all care about the health of our children. We can all care about the health of our parents and grandparents. And I think studying this is a real opportunity to connect people around something we can all agree upon. One of the things I love about my research is that I have a foot in the world of natural resources and a foot in the world of medicine, and being in both of those places at the same time has really helped me see that environmental health is public health.